Good afternoon, everyone, and thank you for joining in on my latest COVID-19 update. Last week, it was announced that as of today, individuals aged 65 or older, or individuals with 2 or more specific medical conditions, and residents and staff of public and private low-income and affordable senior housing are eligible now to receive the vaccine. With this announcement, an additional 1 million individuals in Massachusetts become eligible for the vaccine. People in this phase are urged to go to the state's web portal at vaxfinder.mass.gov to make an appointment at a Mass site or area site, or if you prefer to register over the phone with live assistance, you also can call 211. Please anticipate a wait time to be connected with a person. Even though it has been slow in starting, the good news is over 1 million people in Massachusetts have received their first dose of the vaccine. So things are moving in the right direction, though we understand there is still a lot of frustration out there, but it is getting better. Last week, the state announced that they would give only vaccines to large-scale regional clinics capable of administering at least 750 doses per day, 5 days a week. This move prompted a request for a regional vaccination center in our area. Newburyport, Salisbury, Amesbury, Newbury, West Newbury, Raleigh, Georgetown, Groveland, and Merrimack have joined together to create a regional vaccination distribution group, which has recently run COVID-19 vaccination clinics in West Newbury, Georgetown and Amesbury, and Newburyport for our first responders. Working together, we believe we will be able to support the criteria to meet these numbers and operate a regional general public vaccination site locally. Any plan will need to be approved by the State Department of Public Health, but given that the closest large-scale mass vaccination site is at Doubletree Hilton in Danvers, we think our location will be a good option for this northeast section of the state. We understand that this regional site, capable of vaccinating 750 people a day, 5 days a week, will also be available to everyone in the state. The state sets the rules, but we believe the large preponderance of people who will get vaccinated are people from within these communities, and the site will provide much greater access. We will get others as well, but with the number of doses supplies, there is potential for a lot of people in the corner of the state. But please be patient as we move forward with this initiative. There are many, many moving parts and many details still to be worked out. We do know that it will take time to ramp up with a fully allocated supply of doses from the state. We will provide communication on this as we proceed. All of this is a shared responsibility and a formidable effort to offer safe and effective vaccines to all of us locally and to the millions of Massachusetts residents. Thank you all for your cooperation. The host agreement we completed with Beth Israel Lahey Health, which includes Anna Jaques Hospital, will be able to continue at the Senior Community Center, and notices went out to over 232,000 patients in this system on how to register for the vaccine through their system. They will be ramping up as more vaccines become available and anticipate the ability to administer over 2,000 doses per week at our Senior Community Center. Again, this site is operated through Beth Israel Lahey Health, and registration is through their system, but their system supports over 100,000 patients in the greater Newburyport area. We continue to see significantly lower numbers of new daily cases since the new year. We now see week-over-week decreases since the beginning of 2021. Our rate had been 50% over 100,000 over the holidays. Our positivity rate now is 2.07%. It had been above 5% for the majority of the holiday season. This is very encouraging news, but I ask all of us to continue to be vigilant, make good decisions, and follow the state's guidelines. In regards to our schools, Superintendent Gallagher has been working diligently with our public health advisors and building principals to continue work on phased-in plans to increase in-person learning and ultimately reach our goal of returning to full in-person learning. At each of our schools, there are approximately 90% of the students engaged in hybrid models with 2 days of in-person instruction and active planning to phase in additional in-person learning. At the high school, remote, hybrid, and live streaming is occurring, with more students increasing to attend 4 days per week. We recognize the deep challenges the educational programming and schedules have caused for the district and especially for families and our students. However, our staff have not been immune from this virus, and we have had serious cases and family deaths. And we know our model has been effective, as we have not had to shut down our district to full remote because of outbreaks in the schools. In order to achieve the next steps in returning more students to in-person learning, we have begun surveillance and pool testing that will help us identify a particular classroom or cohort that may test positive. Again, with our model, we can isolate a situation quickly and prevent the spread of the virus. We have also been working with our EMS provider to vaccinate our teachers, but as the vaccination rollout is limited by supply, our efforts were pushed back until mid-March, where we hope there is sufficient vaccine to reach this phase of eligibility for our teachers. All of these efforts are focused on fully opening our schools as soon as possible. Superintendent Gallagher will be sending out further communications to families tomorrow. In other news, we continue to work on a short-term solution for Plum Island and the Reservation Terrace area to get us through the storm season and until the Merrimack River dredge occurs. We are very grateful for the direct support we are receiving from the Lieutenant Governor, Mass DOT, DEP, DCR, and EEA on short-term protections, as well as the strong advocacy from our legislators. The Army Corps of Engineers has started the prep and permitting work for the dredging of the Merrimack River, which we will anticipate happening hopefully in the fall of 2021. I am also very pleased to announce that after decades of litigation, debate, and failed surveys to address a plan for our central waterfront, we are moving forward to create the park and open space consistently and overwhelmingly supported by residents. The first step to move this forward was to honor the long-standing MOUs and understanding that in order to create this space, we needed to relocate cars. This was addressed by the development of the intermodal facility garage. This was followed by the dissolution of the Newburyport Redevelopment Authority and transfer of their property to the city ownership to initiate the creation of open space and park. An RFP process was issued and 14 proposals were reviewed by a team including myself, city staff, city councilors, and community members that unanimously approved Sasaki to design our central waterfront park. Sasaki has a history of work in the city dating back to the 1960s and 1970s in the design of the master plan for protecting our historic downtown, including the creation of In Street and the Harbor Walk. Additionally, Sasaki has a solid history of creating waterfronts, parks, plazas, and open space. We anticipate a positive vote from the City Council on March 8th and finalization of the contract so their design work can begin. Once finalized, Sasaki's proposal will be posted on the Planning Department's website. We have also been working diligently on a plan for the purchase of 57 Low Street, a surplus property from the National Guard. This is an opportunity for the city to purchase 2.1 acres of land for $220,000 for municipal use. I know many of our residents have been engaged and closely following this process. I am very grateful for your outreach and support. There are several municipal needs that would be appropriate for this site, including a much-needed field office for our Parks Department or Youth Services. Parks could utilize the site for 3 years, while the Site Selection Committee for Youth Services reviews all potential options to relocate Youth Services from the Brown School. Tonight, a special City Council meeting has been scheduled for the final vote on the disposition of this property. Additionally, I extend my thanks to our city councilors for supporting the resolution for declaring the first Monday in March as COVID Memorial Day. This year, COVID Memorial Day will be held this Monday, March 1st, to recognize the lives lost to this virus and the grief and struggles that continue for those family members and friends. In our city to date, unfortunately, we have lost 32 individuals to COVID-19. And to recognize those we have lost, at noon on Monday, March 1st, church bells will chime 32 times for each of the victims. The following churches will be participating: the Annunciation Greek Orthodox Church, Belleville Congregational Church, Central Congregational Church, the First Religious Society Unitarian Universalist Church, Old South Presbyterian, and the Immaculate Conception Roman Catholic Churches. Please take time to step outside, listen to the bells, and take a moment of silence. All flags on municipal buildings will be at half-mast. At 1 p.m., also on March 1st, we will hold a short remote service. I will be joined by Reverend Christopher Ney, Central Congregational Church, Reverend Rebecca Bryan from First Religious Society, Unitarian Universalist, Reverend Sarah Singleton from the Old South Presbyterian, and Father Tim Harrison from the Immaculate Conception Church. In addition, we anticipate students from our school district participating in the service. Please go to the homepage of our city website for the Zoom link to watch the service. In closing, it has been a very long and challenging year, and I know we were all anxious to see an end to this pandemic and return to the many activities that have been suspended. To that end, Governor Baker announced today that key public health data of new cases and hospitalizations have been closely monitored, and with a significant decline, the state is allowing for a return to Step 2 of Phase 3, effective March 1st for all cities and towns. This includes the following updates to businesses, activities, and capacities. Indoor performance venues such as concert halls, theaters, and other indoor performance spaces will be allowed to reopen at 50% capacity with no more than 500 persons. Indoor recreational activities with greater potential for contact, laser tag, roller skating, trampolines, obstacle courses, will be allowed to reopen to 50% capacity. Capacity limits across all sectors with capacity limits will be raised to 50%, excluding employees. Restaurants will no longer have a percent capacity limit and will be permitted to host musical performances. 6-foot social distancing, limits of 6 people per table, and 90-minute limits will remain in place. Residents must continue to wear masks to prevent the spread of COVID-19 and are encouraged to avoid contact outside of their immediate households. The travel advisory and other public health orders do remain in effect. Please refer to mass.gov/COVID website for more details. This is so encouraging that we are moving forward with reopening our communities, but we must continue adherence to the CDC and state guidelines. I have confidence we will be successful and continue to see more of our businesses reopening. Have a wonderful week. Stay safe and stay healthy. Thank you.